Why medicine? Because I knew I wanted to become a doctor ever since I was 16 when I spent a week at West Sydney Emergency Department. And I knew that's what I wanted to do for the rest of my life. But let me unpack that carefully by looking at three reasons why I want to study medicine and another three of why I want to specifically study at the University of Notre Dame, which I've put as my first pick. Firstly, I want to study medicine because I've seen so many people around the world lack good medical care, even here in Sydney actually. My 4 years working as a volunteer with the AusAid agency Reladev, where we go to overseas communities such as Vanuatu, Vietnam, and work with local high schools to build new facilities. In each of those trips, we've actually had to bring our own doctor because there are no medical services in the area that we were working. And times when we've had injuries, luckily we've had someone who can treat those injuries. But it's just amazing to me. I learned from those experiences how many people around the world lack access to good medical services. I see this problem even here in Sydney. In my work as a volunteer for Vinnie's Van for 6 years now, where we give food to the homeless people in various locations in Western Sydney. I'm always appalled by how many people lack good dental care, good mental health care, have substance abuse issues, and don't have access to any medical care whatsoever. What is happening in such an affluent society? So I want to use medicine to understand the needs of these people better and come up with better ways so that we can help these people. The second reason why I want to do medicine is because I've seen what good care can do to people and how it can really make a big difference to their lives. I've been working as a disability support worker for 3 years now with Riverlink Disability Services, and I support kids who have autism. When I go on camps with them, it's really the small things which make the biggest difference to whether they enjoy their weekend or not. And it's simple things like managing their toilet habits, making sure their food is cut up so they can eat it, making sure they have their medication on time. And the same thing I think can apply to doctors, where if you do those small things well, communicating well, doing the paperwork, ordering the tests in a professional manner, that will result in good care towards the patient. Thirdly, I wanted to medicine because I love learning about it. And that's why I did the medical sciences at university. I was so passionate about it. I was able to maintain a distinction average throughout university and went on to complete my honours project. Well, actually, the favourite part of my project was interacting with participants and getting their feedback. My passion for learning in general really is evidence outside of medicine. I love learning the guitar, and one of my goals now is to perform at a bar, hopefully when restrictions are sort of lifted off. And I've been learning one song a week. I'm also an avid reader. My favorite area to read is 20th century history. My favorite book is perhaps Ordinary Men by Christopher Browning. Now I want to look at quickly the three reasons why I want to study at Notre Dame and why I've picked it as my first pick. Firstly, it's because I know the support there is first class. No man is left behind. The academic staff are very professional. There's a lot of respected clinicians that come in and generously give their time. There's also support built into the course structure because it takes that spiral approach, and I think that will be very beneficial to me, who likes to have concepts revisited and looked at from different angles. I'm also happy to say that Notre Dame offers pastoral support. I've benefited from this from my experience at high school where we had it, and I loved it so much that I sought out pastoral service throughout my university studies. And recently, earlier in the year, I had a close friend who committed suicide, and that priest that I was seeing helped me really get through that process of grief. The second reason why I want to study Notre Dame is because they're interested in the issues that I'm interested in. For example, end-of-life care and specifically palliative care, because that's a subsection. Because I've seen personal friends of mine who've gone through palliative care, and really I've seen the impact that it's had on their life and the family around them. The third reason why I want to go to Notre Dame is because of the cohort. I know it's culturally diverse, which is important to me as a second generation Korean who loves to share food and experience new culture, but also the diversity of medical experience. I know a lot of nurses, allied health professionals and paramedics take the course, and if I'm studying along them in the PBLs and interacting with them in the courtyard, I'm going to pick up a lot of things that I think are really unique to Notre Dame, such as how they deal with patients and just how good communicators there are, and having good values. And